Thank you for the great introduction, Shaina. It's good to be here. Thank you guys for coming in today for the workshop. So, as Shaina said, I do work for Novo Nordisk and I do hold some Novo Nordisk stocks, but today I'm not here as a company man. Indeed, I'm here for you today. Have you guys seen what that is? That's perfect. So yeah, so I am here today as a potential version of you in this timeline and in this universe. And ladies, don't freak out. You're not going to turn into an average man, but I think you get my points. So Shaina has told you guys everything I have done right, but I'm going to tell you things that I have done wrong to delay my timeline to get to where I am today. So when I was in my undergraduate degree in pharmacology, I was given the opportunity to actually do an internship for a pharma company. I declined that offer because I wanted to graduate as soon as possible so I could actually apply for the Canadian permanent residentship. At the time, I was still an international student. So that was a missed opportunity to actually gain some industry-related experience. And fast forward 2 years into my master's at this very faculty. I was a little too complacent. I didn't really do much throughout the 2 years when I was here, except for being a TA and did something that is academically related. So as I was graduating from my master's, I actually could not find a job. I interviewed with a few companies, but unfortunately, I was never given the offer because one, I didn't have any industry experience. I actually didn't have any work experience at the time because TA experience was not counted as work experience. And also, I was an international student, so usually preference were given to local students. So that was one of the biggest mistakes I had made. And then I went into my PhD at U of T. But then for the first half of my PhD, I was, being a little careless, just like a lot of people. Oh, I'm still early in my research career. I'm going to wait until I'm almost done with my degree, and then I'm going to work on some of the skills that I would need to transition into the industry. And that was also a mistake. So since I got this job in the industry, I have been kind of taking my time to coach some of the students so that they can avoid to make the mistakes I have made. And that's precisely why I'm here today, so that I can help you avoid the missteps I have taken. And hopefully I can give you a little bit of a boost to help you to get to where you want to go faster. So do you guys know what this movie is? Inception? I see a lot of people nodding your head. So what I'm trying to achieve today is to plant an idea in your head. So, and for Inception to work, it's better when you're dreaming. So it's okay if you fall asleep in the next 20 minutes. It might even work better, make you a little bit more suggestible. So the idea why I want to plan in your consciousness is this. Your first job does not define you. It's merely a reflection of you. Or as I would say, your profile. What's that supposed to mean? Well, we're going to go through that. So today we have 3 objectives. So we're going to start with a beyond basic kind of profile sketch. And then I'm going to tell you a little bit about the pharmaceutical industry landscape in Canada specifically, and the 3 most promising or accessible starting career. And then we're going to finish off this workshop by putting your profile into context to answer the question, is the first job your dream job, or is it going to be the best fit job you need? So I am going to ask you a few questions because you know how Inception works. I don't expect you to answer the question, but I want to get you thinking. So The first question is, tell me a little bit about yourself. And when do you get asked this question? At an interview, at a party, when you meet someone in the streets, or you having the very first dinner with your partner's parents in their house? Which one would it be? All right, think about that. And when I ask Google, and that's what Google tells me, it's mostly interview. So let's pretend we are at an interview. After you say your name, how do you usually follow with that? Do you follow with, I have a PhD or I have a master's in Pharmaceutical Sciences, or I'm a PharmD graduate from Pharm Sci? I'm currently working as an expert in a certain field, say in toxicology, or I'm a practicing pharmacist working in Shoppers, or you can say I'm awesome. How often do you say that? Think about that. Now, this is an important question. Do you actually vary how you tell people about yourself when you are in different occasions? Think about that. Now, I assume some of you have brought your resume. If you didn't, that's okay. What I want you to do in the next minute or two is to think about a very valuable experience that doesn't usually make it to the first page of your resume. It usually sits in the second page as a filler. And for those that didn't bring your resume, I want you to think about writing something down that is not a publication, that's not a scholarship or any awards you have achieved, or any conference presentation or anything that is academic related. So think about one experience that you value a lot, but it does not go to the first page of your resume. Take a minute or two. Think about that. So just to kind of facilitate your thought, I give you a kind of real life example. So this is actually a friend of mine. So I asked them to show me the second page of their resume. So they have an experience of being a co-director for finance and business development for a student career organization. So at the time, they managed 4 associates and they raised about $8,000 in their first year. So this is not an academic achievement, but it was an experience within the academic environment. So that could be something you put down as the answer to the question I have asked you. So I'm going to give you another 30 seconds to think about a valuable experience that's not going into the first page of your resume. Okay. Now I want you to tell me even more about yourself. So in the next minute or two, I want you to write down something that is very memorable to you, that you have done or achieved with great passion, or you have done it with a lot of effort, but it doesn't usually make it to your resume at all. That's something you talk about on a personal level, but you don't really talk about it when you go for an informal interview, or you don't actually put it on your resume at all. So I'll give you some examples. So maybe some volunteering experience, because most of the time when we try to put something on our resume, it's a work-related experience. And most of the time it has to be significant enough for you to think the hiring manager will actually look at it. So an option would be some insignificant job experience. That's how you think, but that's not, that might be perceived by someone reading your resume. Or anything that is non-academic related, some events that you have organized or executed, or anything else. Right? So this experience does not make it to your resume at all, typically. I'll give you an example. So this is the same friend. I asked if she had any sales experience when I was helping her prepare for her application for a medical science liaison job. So the same job I have, so an MSL job. And here's what she said. I don't have anything in the sales realm. I have been in school all my life. I did my undergrad and my master's, and then now I'm in my PhD. I'm finishing my PhD. And then I asked her, are you sure? So she thought about it, and that's what she told me. She was like, oh, well, if you have to ask, I have been working as a server in a hotel restaurant where I try to tell my customers what food and drinks they might like. So technically, I am selling items for the restaurant, but maybe I wouldn't count that as sales experience, maybe. But maybe that can be considered as customer service experience. Maybe, maybe not. Okay, so now you should have a partial profile of yourself. So you would have a valuable experience that sits in the second page of your resume. Most of the time it's there as a filler, so you have a 2-page standard resume for any industry job application. And then you also have an experience that doesn't typically make it to the resume. And I'm going to tell you why I want you to put those two there as your profile. And then we're going to leave the third one empty for now. Okay? Okay. This might be what you're here for. So I'm going to tell you just a little bit about the Canadian pharmaceutical industry landscape. So this is statistics from last year. So that's based on the estimation of the performances of various companies in Canada in 2022. And the statistics shows by 2030, the market size of the Canadian pharmaceutical industry will reach about 40 billion US dollars. And as of last year, those are the big five. So Novartis, J&J, Bayer, Pfizer, and Merck. And that was the estimation from last year. And now we're in 2023, and we know that was not right. But anyway, that is not important. That doesn't really concern us because none of us is trying to become a CEO or a director of any company. What you and I want to know is what are the career opportunities for people like us who are fresh out from the school, who don't have any industry experience, because now we are caught in the 2020 catch rule, right? So can I see hands who are in the research stream, including the ones that are online? Great. So we do have quite a lot of you guys in the research realm. So in order to understand what are the career opportunities for people like us, we have to look at what we call the LCM, or the life cycle management. And for those who are currently in the research stream, research or R&D would kind of be the natural choice for us. And for that, you don't actually need me. So I'll give you an example. So Chinook used to be a biotech company based in Vancouver. It still is, but it was recently acquired by Novartis. So now it's part of the Novartis portfolio. And I'm showing you a smiley face of some guy. He's not some random guy's uncle from Hong Kong. He's actually from here. So he graduated from UBC with a PhD, I think, in chemistry, and he's currently a senior scientist at Chinook. But the timing for him and some of his fellows were quite opportunistic because at the time, Chinook was still a Canadian company. So it was easy for people like us to get in. But the majority of the pharma companies have their R&D elsewhere, just not in Canada. It's getting more common these days because a lot of the pharma companies have started acquiring small biotechs in Canada. So for example, Novo Nordisk, the company I work for, we recently acquired a biotech company in Canada. So I guess where is the opportunity abundant for people like us? So we're going to look at a very kind of a short window that is just right before and after market authorization. So what I want you to remember is 3M because that sticks. Just for information, not the tape. It's 3 medically related career types. So medical communications specialist, medical sales representative, and medical science liaison. So the 3 M's, remember that. So those are the most promising careers graduates like us can get as our starting career. So medical communications, sales, and science. So what is a medical communication specialist? Remember 2 PMs. So 2 streams, you can be a PhD or a PharmD. If you are a PhD, you can become a medical writer. If you are a PharmD, you can become a medical information specialist. I know medical writer sounds boring, but you're not always writing. I know the name makes it seem a little bit boring, but it has all the names. So sometimes we call them vendor because they do provide a variety of services. Sometimes we call them agencies because they can do a lot of things for us. So this is one example of what a vendor or an agency looks like. 6 Degrees Medical is a company based in Toronto, and that's their slogan, Reimagine Science, and they claim to be able to help pharma, biotech, medtech companies to connect with healthcare providers, patients, and payers. I'm not going to read through it, so that's kind of what they do. I'm going to give you a list. So medical writing is a very traditional service they provide. I was a medical writer for a couple of months, just right after I finished my PhD. I wrote a manuscript for a pharma company. So that's what you can do as a medical writer. But a vendor or an agency does more than just medical writing. They can act as like an events planner. They host consultancy meeting or advisory board for pharma company. They can also provide support for clinical trials, and they also create contents for online education programs or any medical communication. What about medical information specialists? And that's truly for you, my friends, in the PharmD program. So all the pharma companies have a medical information department that accepts medical inquiries from both doctors and patients. And MedInfo specialists commonly address those questions and issue formal letters to doctors and sometimes patients. What about medical sales representatives? Sometimes we call them sales rep for short. Those are the people where whom the doctors will get their information on the medications from. What about MSL? Well, they are also the people whom the doctors get their information from. Then you might ask the question, oh, are they the same? Well, they're similar in a way that both sales reps and MSLs are client-facing roles, and they have to be strategic and business-oriented because at the end of the day, both roles work for a pharma company. One big difference many healthcare professionals and also pharmacists know is the off-label discussion. So sales reps are limited by what they can discuss with the healthcare professionals. MSLs can discuss anything that is related to the data that are available. And MSL also stands for many stuff left to do because there are a huge variety of things that we actually do. And those tasks are actually dependent on the company. Now, KOL or key opinion leader engagement and development is a core function of an MSL. But there are other things that MSLs do that are very dependent on the company they work for. So for example, clinical trial support. Here in Novo Nordisk, MSLs, we do support clinical trial. But if you are an MSL with companies like Novartis, they have dedicated clinical research team. So you don't actually need to support your clinical operation colleagues. And as MSLs, sometimes we provide training to sales reps, just like a medical advisor. Sometimes we don't. It depends on the company. Now, let's complete the profile you have in hand and then put that in context. So far you have a valuable experience that usually makes only into the second page of the resume. And then you also have an important or valuable experience that means a lot to you personally, but it doesn't really make it to your resume. And now you can put on the third one, which is what we normally are very proud of. It's our scientific expertise, our academic achievement, our top skill sets. So let's try with an example I gave you before, and then I want you to take maybe a couple minutes to work on your profile, because then you'll be ready for the questions you want to ask me later on. So as I showed you before, this friend of mine, they were a co-director for finance and business development for Student Career Development Society. They raised money for the organization by providing career services. And they also managed 4 associates. And they happen to be a server at a hotel restaurant. And last but not the least, they had a PhD in pharmacology and toxicology. So this person actually comes from my old department at U of T. So there are 2 questions I would ask you, and I also want you to think about. The first question is, what roles would this person be qualified and why? Maybe a better question would be, what would be the easiest role for this particular person to land an interview for and why? Right? I want you to take 1 or 2 minutes to think about those 2 questions, either based on this real life example or based on your profile. Right? So I'm asking you, which of the 3 M's you think this person or you would be qualified for and why? And what would be the easiest role for you to land an interview for, or for you to get one straight out of graduate school or pharmacy school, and why? If anyone wants to give it a try, anyone online wants to give it a try, go ahead. You can unmute yourself. Anyone live here want to give it a try? Okay. What's your name? Nice to meet you. Okay, I want you to hold on to your answer. Anyone else wants to give it a try? Anyone online? Yeah, go ahead. Can you speak a little bit louder? Mhm. Okay, perfect. Okay, I want you to hold on to your answer. Anyone online wants to give it a go? Three, two, one. Okay, so you're both right, and they interview for actually all three roles, and you were dead on. So that's what she got. She became a medical writer. Um, Actually, the customer's service experience also gave her a little bit of a boost for getting into, these days we call them the medical communications business or industry, because you are a vendor or an agency, so you work for clients, and your clients are typically pharma, biotech, or medtech. So they interview for both. The medical writer position was the one they got, and because, like you said, the PhD background. Okay, so for those that are applying for the pharmacy industry residency program, so this is the list. I'm sure you are aware. Typically, we have about 11 companies in Canada offering 35 spots throughout the country. So you're looking at over 200 applicants with 35 spots. And I hope after today, you can understand what your profile is so you can pick the best battle so you might win. And deadline to apply is Friday next week, October 20th. So I'm going to give you kind of a story of a mentor of mine who actually helped me a lot at the beginning of my journey when I searched and interviewed for jobs in the industry. So he had a PhD and an MBA. His first job was a sales rep, actually, in 2014. He worked for 2 years, and then he got an internal promotion to transition into an MSL, and that was actually his ideal starting job in the same company. He worked for another 2 years, and then he met an MSL manager from another company at the conference who wanted to recruit him. So he jumped over with a better salary and a better manager. And then he worked as an MSL for another company for another 3 years. And during those 3 years, he declined any internal and external opportunities to become a medical advisor. I actually, at some point, tried to recruit him to our company because we had two openings. And he said no, because he wanted a more flexible um, schedule so he could raise his little daughter. And then in 2021, so 2 years ago, he accepted an internal promotion to become a medical advisor. And that's where he is today. So I want to leave you with a question. So what is more important to you for your first job? The best role you would want, or the best fit role you would need? So remember this. Your first job does not define you. It's merely a reflection of you. Right? So that wraps up the workshop, and I'm happy to address any questions you might have live here or my online audience. So thank you so much for being here today.
Thank you, Kangbin. So we'll start off with a few questions that were sent in when people registered. So the first one here is, how do you break into pharmaceutical companies with a PharmD background?
That's a good question. I think after today, you have the answer in your hand. And to be honest, I don't think that was that was the right question to ask, because like how we work your profile, your degree is on number 3. So it actually doesn't matter if you have a PharmD degree or if you have a PhD. It doesn't really matter. because industry doesn't really look at your academic achievement. Because, for example, in the past 2 years, our company has had quite a few hirings. And for each MSL opening, we had over 200 applicants. So we have PharmDs and PhDs. So does it matter what degree you have? No, it doesn't. It matters what your profile is, what your skill sets are, and who you are. So the reason why I asked you to put an experience that you never make it to your resume on the second spot is because that is something that we will be able to tell in an interview. I have been in enough interview sitting alongside with hiring manager because I'm a senior MSL. Because at the end of the day, we are not hiring a resume. We are hiring a person. We want to know who you are, what you do on a personal level, and whether you'll be a good fit for the company. So it's not just about your skills, and it's also about your personality, whether you'll be a good, what we call a cultural fit. And the first experience you put on your profile is what you can leverage to convince the hiring manager why you deserve to be in this role, not the other 149 candidates. So I hope that answers the question.
This, I think, ties into that first question. So what do you recommend students do in school right now to prepare for the industry and how to get into the industry upon graduation? I mean, you touched on some of this during your presentation, but what are some of the things they can do? Because when they apply, they might get rejected because they have no industry experience.
Okay, that's a very good question. Okay, so the answer depends on what you want to do, right? So when you look at a job description, so what you can do kind of the reverse profiling. You profile the job, right? Look at the job description and see what they require. So for example, if you're looking at a sales rep job, so that means you are going to need some sort of sales experience or adjacent sales experience. It doesn't have to be selling a medication. You could be working in Starbucks. You're selling coffees, right? What do? Customer service. And as a sales rep, that's what you do, customer service, right? So what do you need to do to get into the industry depends on what you want, right? But it doesn't mean, with that said, it doesn't mean you have to focus on one skill you're trying to hone on. You can, depending on how much time you have outside of your academic life, you can try to do some volunteering experience or you can get a part-time job. Because at the end of the day, when you put an experience on a resume, nobody's going to know if that's a part-time or full-time, right? You do a job for 6 months. If you do it well, that's no different from doing a job for a year or 10 years, right? So all you need is what I call, I don't know if you need this, but personally, I have the collector approach. So it depends on what the jobs or what is the job I'm looking for. I'm going to collect the skills and the experiences I'm going to need. So then when I apply, maybe I don't have the direct work experience, but then I will have the relevant experience that is good enough to help me get into the industry. Yeah.
Does anybody in the room have questions? Online? Feel free to put them in the chat. Okay. In the meantime, I have extra questions for you. Kangbin, what would you suggest? What are some pathways to networking to enter the industry as a entry-level individual?
Okay, that's a good question. So that actually requires efforts from, I guess, both from an individual level and also from the institution. Because when I was at U of T, I was fortunate enough to well, we were fortunate enough to have the Career Development Society, so I was also part of. That's actually where I got to know and network with professionals from the industry. And in Ontario, there's also a program, I think it's called S2B, is Science to Business. That's actually a multi-university organization that has chapters in different universities where they will host um, events like career networking, small roundtable. So as what a mini networking event roundtable would look like is you would go to a restaurant and the organization will host a dinner, and then they get a few healthcare professionals from the industry, and they typically have different themes. So one time would be medical affairs, the other time would be clinical development, and then one time would be pharmacy residence program. And then you would rotate at different tables, and then when you can talk to those who are already in the industry. So those are the events that are typically hosted by either the university or the student organization. And I believe here at Pharm Sci, we do have a student organization that organizes these career events, especially for the PharmD candidates. I forget what the acronym is. I know they do host events occasionally. And then I believe the last event was with Sanofi, a panel of MSLs, I believe. So those are the events you should pay attention to. And sometimes there could be other organizations outside of this faculty that would organize events like that. So that would be a good starting point.
Thank you. Some of the other questions I have here are, what is the experience of working in this particular field?
What is the experience?
Yes, what is your experience?
Oh, that's a very good question. So I guess I'm going to have to be completely honest with you guys because I do want you to know what you might be getting yourself into. So I started as an MSL, and an unfortunate fact that whenever you are an MSL based in the West, you have a very large geography. Typically, you cover 3 to 4 provinces. So my experience in first year was not so great because I had to travel every 2 weeks. I barely stay in my apartment. I actually stay in hotels more often than I did at home. But I guess the most thrilling part of the job is you actually get to apply the knowledge you just learned. Like, because typically as a research student, we are very specialized in our field, and most of the time, only people in our lab or in a similar field will understand our language. So typically, when we do a seminar presentation, we don't get a lot of enthusiasm or responses from the audiences because people don't usually understand what you're trying to say, and mostly because the knowledge is not very applicable to them. But as an MSL, whatever you learn on the job is very applicable. So all that science you learn on the job, you communicate the data to the physician or any healthcare professional. And at the end of the day, that knowledge help healthcare professionals, especially physicians, become better physicians, and who benefits in the end? The patients. So what we do as MSLs actually matter, and they have very immediate effect on the other's life. So that is the most rewarding part of this job. So there are certain things you don't like. Is a very steep learning curve at the beginning. You get mountains of data you have to learn if you're not already in the same field. I was not in the same field. I transitioned from cardiovascular science to diabetes and obesity. So that was a steep learning curve. So typically as an MSL, it takes about a year to get used to the data, and it takes more than a year, sometimes a few years to actually build and consolidate those relationships. Because what we do hinges on how good of a relationship we have with the healthcare professionals, because you're asking them for their time, right? Typically, they spend half an hour to an hour with you. That means uh, they're missing half an hour to an hour of the time at the clinic. And why would they want to spend time with you when they can um, have an income of $300 to $400 for one consult with patients? Why would they do that? Right? Because there is a need, right? You have to find out what they need and you give it to them and you want them to keep coming. But because you also work for a pharma company, so there is a balance, right? You don't just work with the physician, you also work for the company. So you act as a conduit to flow the information between the healthcare professional and the company. So I know it's going to take maybe another hour to sum up what this role is, but this is what an MSL is like. And the first year is going to be tough, but then over time, once you get used to the data, once you have established relationship, then it becomes a very fun job, because whenever there's new data come out, you get excited, you learn it, and then you get your customers excited, and you also get to go to conferences to learn the state of the art knowledge. So you get to travel. So not just traveling to cover your geography, but actually traveling to conferences to learn. So I hope that kind of answer maybe 50% of the question.
Thank you. The other question I have here is, do you need to complete any certification for MSL?
That's a question I've been asked many times. The answer is no. I don't think it's a good use of your time and especially your money. The certification actually costs quite a bit. And I did, in the past 2 years, try to work a deal with some of those certifying bodies to see if they can actually give students discount, mostly for UBC and U of T, the two schools I used to be in. And unfortunately, they wouldn't want to do it. So, and the certification works if you are in the States. In Canada, it doesn't really matter. I have seen people who have spent thousands of dollars in certification and they still don't have a job. So it doesn't really matter if you have a certification or not, because that's going to go into point number 3 on your profile. It matters number 3, not the top. Quality of you, that matters to in the eyes of the hiring manager. So can you speak to the mic so the online audience can actually hear?
Okay. I was wondering if you have any suggestions on the cover letter, because like this was very interesting for like the CV. But then I'm wondering for the cover letter part, if you have any advice, or like, for example, your point 2, which is experience that you usually don't go into like CV. It's like the cover letter a way to highlight the soft skills that you have learned from like that experience? Or like, would you just still put it in the CV and not mention it in the cover letter? Like, if that makes sense.
That's a good question. Cover letter and point number 2. So yes, cover letter is a great place for you to put on the number 2 point on your profile, because that really showcase who you are beyond the resume. And typically when we write a cover letter, it has to be very specific, very targeted to the company we apply for. And typically how I coach my mentees and my students is do not repeat. I guess in a large extent, do not repeat what you have in your resume, because there's really no point of writing or putting a summary of what you have written on your resume. The cover letter should showcase who you truly are. Yeah, so cover letter is one good place to put that. And also by the time you get to an interview, that is a point you should speak to, because that will show who you are. And that's how you connect with the hiring manager in the one-on-one interview, because they have read your resume. There's no point of trying to tell them, hey, I have a PhD in Pharm Sci and I specialize in whatever, right? So showcase who you are, and that's very important. I know sometimes it's a little bit hard when you're at an interview or when you write a cover letter, or you might be, oh yeah, that might sound silly and just something personal. You're not very comfortable. But that's exactly why you have to put it on a cover letter if you want to, and also why you have to speak to when you're at an interview. Because getting a job is one thing, but if you get into a company that is not really a fit culturally for you or for the company, or you realize, oh, that's not a manager or a team I want to work for, then you're going to have a very bad experience in your first year, and that could impact your journey to the future, right? Because most of the time, I can probably say 99% of the time, the first job is not your last job. So yeah, very good point. I think we have about 5 minutes left. I don't know if there are any more questions.
Any other questions? I don't see anything online. I guess I had a question, Kangbin. So, you talk about putting something personal in the cover letter. Can you give an example of something you included in your cover letter? I mean, was it, your entrepreneurial skills or kind of the dance group? Like what kind of things can people include in their cover letter to make it more personal, stand out?
Yes, that's okay. That's pretty good. So typically in my cover letter, I would put on my dance experience if I don't have space um, on my resume, because that shows I am a passionate person. And also the reason I founded the dance organization at U of T was because I saw a need where we had a lot of good dancers who wanted to teach, but they had no platform for them to do so. So I saw that as a need. I started the dance organization, and I invested my own money, which made me very broke for a year. And I did make the money back in the subsequent year from the classes and also from the dance competition I held. And that showcased my, I guess, my entrepreneurship, right? So I saw an unmet need. I fulfilled it with my creation. And then I held a dance competition that generated $2,000 in one night. So that shows um, I can be business oriented. So, and that's actually a quality they will look at if you want to apply for a job as a sales rep or an MSL.
Okay, great. Thank you. We're at time, basically. Do you have any last thoughts, Kangbin, before we wrap the session up?
Uh, I guess I kind of want to repeat this. Your first job actually doesn't really matter. What matters is you get out. Because the longer you stay in academia, the harder it is for you to not only get out because you will get very comfortable, but also from a hiring manager perspective, they see, oh, this person has been doing a postdoc for 6 to 7 years, right? So that makes me wonder if they want to move into the industry because they get bored with academia, or they might have tried certain things, but then they couldn't get in. So there's doubts that might be raised. And I know how important it is to get your dream job when you first get out. But for me, the truth is it doesn't really matter that much. I had 3 part-time jobs as I was getting out of academia. I work as a full career, so I work for Uber Eats, and I did a one contract with a startup company in Toronto as a bio content analyst, and then I also work as a medical writer for a contract. So 3 jobs when I was being a so-called postdoc in the same lab, but that's not counted as postdoc. You have to go to another lab, right? So I couldn't get an MSL job for a long time. I started in the summer of 2017 when I finished writing my thesis, and then I didn't get a job until December 2018. And it took me 9 months to actually land the first interview. And once you get that first interview, then things start coming. I can promise you that. And also, you're going to need a few interviews to get enough interview experience to behave the best of you in front of the hiring managers. So that would be my final thoughts. So thank you so much for coming today. I'm going to hand it back to Shaina.
Yeah, thank you, Kangbin. Thank you so much for attending, everyone. And it's great to have you back.